Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Katherine Stueland, the CEO at GeneDx. Katherine, how are you?
I'm doing really well. Thanks. Thanks for having us today.
I'm excited to have you. Um, let's dig right in. I always ask this question. This is my probably most over asked question, but you're walking down the street, you're in your GeneDx swag. Someone goes, "What is that? What does that company do?" What do you tell them?
We diagnose children with rare diseases, and our entire company is really designed to help diagnose any genetic disease as early as possible in order to prevent the progression of disease and help people be healthier.
So let's talk about that for a second. So let's specifically talk about the state of genetic testing for rare diseases. Where are things at today? What should our audience know?
You know, rare diseases, it's kind of a misnomer because 1 in 10 Americans have a rare disease. So they're actually quite common. And I think most people might be familiar with epilepsy, with autism, with children missing milestones. And all of those together really impact a wide population of humans. And so, when we think about the problem that we're trying to solve today, it takes an average of 6 to 8 years for a child with a rare disease to get a diagnosis. And there's no reason for that. We can do it within weeks, if not days. It is affordable. So most insurance companies do cover the cost of our services. And so I believe that genetic testing has been considered to be, really on a pedestal, a test of last resort, something that's really expensive, takes a long time. And thanks to a lot of different technologies coming together, we've been able to make it much more accessible, much more affordable, and much more actionable for a growing number of patients and families.
What is GeneDx's kind of thought process when like a new rare disease is introduced, right? Like how do you how do you think about which you should focus on and which you don't? I'm curious.
Yeah, so there are 7,000 different rare diseases. And we are finding new gene disease correlations routinely. So we're actually the ones that, through our clinical expertise and our data engine, which is comprised of about 700,000 clinical exomes and genomes, we're actually the ones who are doing quite a bit of the disease and gene discovery. And so I think what's so powerful about the way that we are tackling this problem, if you think back to 15 years ago, genetic testing was really done gene by gene. So it was testing BRCA1, testing BRCA2. We then moved into an era of looking at dozens or a few hundred of genes. But what we're doing at GeneDx is we are looking at the entirety of the genome, and we are able to really be able to ensure that we have a comprehensive answer. So we don't actually have to choose like what rare disease to focus on. When we're making a new gene disease discovery, we're able to upgrade or downgrade what's known as a variant of unknown significance to say we now have enough conclusive evidence that shows that this gene is likely or definitely associated with a disease, and therefore we can provide diagnostic information that helps a doctor diagnose. So this is really an efficient way to be able to diagnose all rare diseases, even as we are making new gene disease discoveries.
Now, I know something our audience would love to hear, anyone would love to hear, right? Is some of the stories of families impacted by rare diseases that you've seen.
So these are some of the most inspiring families. You have parents who are willing to go to the ends of the earth to try to get their child diagnosed. And you have parents who are really coming together in a grassroots way in order to help one another um, figure out shortcuts through the healthcare system to be able to either get somebody else's child diagnosed or figure out how to identify a new investigational compound. So today in healthcare, many biotech companies are, and pharma companies, they're the ones who are generating the investigational compounds that they want to be able to target. A lot of these parents are actually creating this drug discovery and development engine through their own work out of service to their kids. So there's one mom who we've gotten to know whose child was diagnosed with a rare form of epilepsy. She was a high school English teacher. You would think that she has a PhD in genetics today. She actually went and found a researcher in Australia who was focusing on this particular gene mutation and was able to bring that compound to a biotech company here in the US to be able to see if they are willing to develop it. So there are countless stories of these parents who are doing the heroic work of not only pounding the table to say people need to be focused on diagnosing more and more families, but also really shedding light on this diagnostic odyssey that they're going on that is so costly, and it's devastating in terms of not only the disease progression for the child, um, but there's also a higher rate of depression and anxiety for the child, depression and anxiety for the parents. There's a higher rate of divorce for these families. It is a whole family problem that is really devastating. And what gives me great hope as we continue to diagnose more and more children with rare diseases, as we continue to make more gene disease discoveries, is that you've got this army of parents who are coming together to figure out how to take a different approach where they are finding the investigational compounds to bring to biotech companies here in the US.
It must be one of the coolest parts of your job that is hearing, like, obviously I'm sure you hear some bad stories too, right? But like the positive ones must be um, super inspiring and make what you love, what you're doing, make you love it even more. Um, One of the things I also wanted to talk with you here about was, being a public company is not easy. I would like to talk about, really what you attribute the recent like stock turnaround to. Um, would love to hear that, and then anything you can tell us in terms of what's next. I know there's certain things you can and cannot say. So in what you can say, we'd love to hear.
I think one of the benefits of being a public company is actually we have a bigger platform to be able to bring these family stories to life for so many other people. So again, appreciate the opportunity to be able to really zero in on these families that are doing so much of the heavy lifting. But part of what we have been able to do at GeneDx, I guess, is to take a step back. We were founded at the NIH and spun out of the NIH 24 years ago. So the company's been quietly solving these cases for a growing number of families. And we were acquired in 2022 by a company that had gone public. And we went through a massive restructuring. And really, on the other side of that restructuring, um, revealed a really strong growth engine in GeneDx, where we're increasing utilization of testing, we're making the company more efficient. We've been able to show a really disciplined approach to deploying capital. And just about a year ago in Q4, we were able to deliver, I think, a really a really strong quarter that's representative of the potential for the company. So we reported on that in we released preliminary results in early January last year, and the stock has been reacting positively quarter after quarter. We continue to do what we say we're going to do. We continue to beat our internal estimates as well as street estimates. And so I think investors have really just taken notice to a more focused approach at solving an ever growing problem that is impacting so many families in the US as well as around the world.
What would you say is the favorite part of your job, Catherine? I mean, I'm sure there's a couple pieces, but if you had to narrow it down to one or two.
I would say the two parts of the job that I love the most. It is incredibly rewarding when we can provide a diagnosis and put an end to that diagnostic odyssey. Not knowing is incredibly hard for families, um, and so anytime I meet a family where we're able to provide an insight and an answer, that gives me just a great sense of pride, and it does for all 900 of our employees. We are so rooted um, in this mission. I also think with so much investment and focus on rare disease therapeutics and gene therapies, it's incredibly rewarding to be reading a story um, about a child who has been successful being on a gene therapy and who can hear for the first time. And knowing that we were a part of that child and that family's journey and diagnosing, and being able to then connect that family with a biopharma company that has a potential treatment, that part is incredibly rewarding. So I think that it's part of what keeps us going on hard, challenging days, and it's part of what we hope to be able to do in the long run, which is really ensure that we can get people focused on less on figuring out what's going on. That's the hard part that we can do, and keep these families focused on how to support their children to get healthy as soon as possible.
When you think of your leadership style, what does that look like? How do you like to lead? Are there any lessons that you would also feel free with sharing for other leaders out there that um, let's focus in on first off just running a publicly traded company too. But I know whenever I have a CEO or other executive on, I like to also ask some leadership related questions because the audience also enjoys hearing from you on those topics.
Awesome. Well, one, I would say hiring great people and seeing them succeed in service of patients. I love to be able to be in a room, and we just had our extended leadership team together this week. I love seeing a group of really talented, passionate people solve problems together, and it's extremely rewarding when I can sit back and see that they're solving them. And it's my job in those instances just to make sure that they have the prioritization, they have the resources, they have the capital, they have the direction that they need. But seeing a group of people come together, it's like the best team sport. So those are days that are really like exhilarating for me. But I would say when I think about the transformation that we've been through, when we got acquired by the company Semaphore, which happened in 2022, I became CEO of the combined companies, and the parent company that acquired us was burning through $90 million a quarter. They had a nascent business in oncology that had negative 800% gross margins. They had declining ASPs in their reproductive health business. And it was a really massive leadership challenge to be taking over a company and making decisions about should we be shutting down these business lines for the sake of ensuring that we can be successful, be a successful entity in our ecosystem. And I think some of the lessons learned there, like be data driven, be decisive, and and really take a hard look at the impact that you're having to say where is it that we're making, where we have a distinct advantage, where is it that we have a distinct strength. It can be really tempting to say, well, this is a really good business, and um, we want to make sure that our revenue profile looks like X, Y, or Z. But what we were able to do is take a look and say, if we have a limited amount of capital to deploy, we want to make sure we're deploying it to the part of our business where we have a competitive advantage. 80% of exomes have been run through GeneDx. How do we make sure that we can continue to be the de facto leader in our space? And putting a little bit of capital here, putting a little bit of capital here, and really spreading it across different business units, we determined was not going to be the winning bet. We made a bet that if we put our capital really towards solving this big problem that a lot of different companies are not focused on. Many companies are focused on the really important, complex job of diagnosing cancer, of monitoring for cancer recurrence, of treatment selection. There's billions of dollars going into that. This is a neglected subset of patients that we have the ability to really solve problems for that other people aren't paying attention to. So when I think about like one of the biggest leadership lessons in bets, it was going against the current of where everyone else was going to say, we believe that this is a really growing market and we know that we're the leaders.
How do you make that decision as a, because those are the uncomfortable decisions, right? Like it's the decision that you have to make as a leader. But I think this is something I hear a lot of people ask, right, when they're asking how do certain people lead these companies. How do you balance a gut decision, which has to come into play, right, versus what the data tells you?
There's data. When you hear negative 800% gross margins, it seems really obvious, right? It's like, that's not a good business. And when you look at an analysis of, okay, how much capital do you need to make that business, not just like gross margin neutral, but gross margin positive. Um, that part of the analysis is I think it could be considered the easy part. When you think of on the other side of that, around the same time my mother was diagnosed with cancer. So on a very personal level, it was like, I don't want to abandon something that could really have an impact on so many patients. But it also was important to take the analysis and you know run it through different leaders in the company and get their different thoughts on it. And we did that with the cancer space. We did that in the reproductive health space. And I think this is where, like, when really good teams play well together, you're challenging one another. And in the reproductive health example, we had really good debates because the data were a little bit less clear than the oncology data, right? It was one factor was we were investing $30 million a quarter, and can we continue to do that? So we had a lot of different debates, and I think in listening to other people, I could have just taken the data and made the decision, but really bringing in a diverse group of perspectives, diverse experts, and really listening, everyone started to really coalesce behind this is the right decision. And it felt like we were all marching towards that together, which made it, as the
Yeah,
CEO, way easier to then say, this is going to the board to say, this is the right thing to do.
I love it. I have two more questions for you. One is a
Yeah.
fun one, and then we'll
Yeah.
get to just the what's next. But if you could be on a panel with any three people, what would be the topic, and who would be the people?
Oh my goodness, that is such a fun one. It's like it's a version of like the ideal dinner party. Um,
And it wasn't planned, Catherine. It just came into my head this second. this was, I didn't write this anywhere. I'm just like, I really enjoyed this conversation. I'm like, I'm going to ask you a fun one. Now,
I,
another fun one.
I love it. I love it. So I would select somebody completely outside of our industry. I would pick somebody like a Melody Hobson from Ariel Investments, because I have great admiration for the way that she analyzes businesses and invests in them. Um, and I don't think that there's a ton of time and attention that they spend in our space. But I think having a very different point of view from different industries could be super interesting in terms of how do we as a healthcare industry solve problems differently. We get into like kind of this very comfortable spot of this is how the industry works. So I'd love to have somebody who could just challenge the entire way that healthcare works in the US. So that would be one. I would also invite Peter Marks from the FDA, who is responsible for looking at all of the different therapeutics that are coming through um, for these children with rare diseases, and how do we then work with FDA more comprehensively to be able to solve these problems. Um, and then I would invite Effie Parks, who is a mom. She is a patient advocate. She's a parent advocate. Um, I don't know if I can say badass on the podcast, but she
Of course you
is.
can.
She's just
It's welcomed.
she she is just she is the reminder of the problem that we're trying to solve and the sense of urgency that we have to solve it. So I think that those three would be my picks for the ideal panel. And I would even go so far as to say the dinner party too.
I love it. Yeah, you just gave me another idea. If I had to, you can say badass, of course. It's one of my favorite terms. We're not going to do this with your video, right? I'm not going to do that to you, especially as a public company. But I was just wondering if you saw in your feed, if I beeped out certain things, even if there weren't swears, wouldn't you
Yeah.
be more inclined to click it? So maybe that's an experiment for another time, right? Um, but last question for you, and then we wrap up. In terms of what you can say, what's next for GeneDx?
We're continuing to solve this problem both in the outpatient setting, but we're also starting to move into the NICU. So for babies who are in the NICU, that's a really big focus for us in the future. Testing is just woefully underutilized in that setting. Um, so that's a big focus. But then the other thing that really gets me very hopeful for our healthcare system, we're doing a study in New York State called the Guardian Study, where we're doing whole genome screening for about 450 conditions on healthy newborns. And what we've been able to find, it's in collaboration with New York State, Columbia, and Illumina. What we've been able to find is that 3 to 4% of healthy newborns actually have an actionable genetic disorder. And so these clinicians are starting to intervene with these kids to try to prevent the progression of disease. And that's where we want to get to. We don't want these families, these children, going through many, many years of just letting the disease continue to erode their health. Um, and so when I think about the future of where we can take our technology, it's using it as early as possible. And for us, that means at birth.
I love it. Katherine, we need to have you on again because I really enjoyed this conversation and appreciate your insights. And thanks for also engaging in some maybe not necessarily standard questioning. And I appreciate your answers.
It was so fun. I look forward to next time.